WCNC-TV, Charlotte. Live from NBC Charlotte, this is Charlotte Today with your host, Colleen Odegaard. Featuring Davey Sutton.
It's the third day.
We're all about the people, places, and events that shape the Queen City. We'll show you how to make your life easier, save you money, and you'll meet interesting and surprising people who have something to say. This is Charlotte Today.
No matter how much you work out, how thin you are, how much weight you lose, most women have some cellulite. Now there's a procedure to attack it from under the skin, and patients are seeing dramatic results. Welcome Dr. David Klein from Renaissance Plastic Surgery. Dr. Klein, thank you for being here.
Hi Colleen, how's it going?
Fine, thank you.
Good.
All right, let's talk about the dreaded cellulite. It's true that most women seem to have it. You can be teeny tiny, work out all the time, and still get some cellulite on the back of the thigh. Why does that happen?
You're exactly right. A lot of people equate that cellulite with too much fat or being overweight. It really has nothing to do with that. It's really the structure of your skin that causes those little bulges and dimples that give you that so-called cottage cheese look.
That we don't like.
Nobody likes it.
Okay, Cellulaze is what you want to talk about.
Right.
The Cellulaze laser. What is it? How does it work?
It works by actually treating those little structures that are different in women than in men that cause that dimpling or cellulite. And we have a little video here to show you that these little bulges that cause the herniation of the fat here, we go in with the cellulite laser and melt that down. And then those little septations are what cause the dimples, and we're going to go through and cut those so that those septations don't cause the dimple anymore. And finally, then we go across underneath the surface of the skin and tighten and smooth the skin with the laser itself, so it thickens the skin and tightens it up and makes it much smoother.
Who's a good candidate for this?
Well, really anybody that has cellulite. Obviously, the better your skin is in general, the healthier you are in general, everything works better. But really, you can treat anybody with cellulite.
Okay, does it hurt? What does it feel like?
Well, the nice thing about this is you don't need to be put to sleep for that. We give you a couple of Valium and a couple of pain pills to relax you. Once the local anesthetic is in the area, then you shouldn't feel anything at all.
Very good. How many treatments are necessary? Do you get one and you're done, or do you need a series of treatments?
One and done. Pretty much, you know, in that area, as long as you know, it's not the whole body. But
right.
Obviously, we want to treat an area, matching sides, of course, so that you're even. The treatment takes about an hour or so.
That's it.
I have done people with no pain pills at all, just the local anesthetic, and it works fine. You generally are going to see results within the first month, and then it gradually, as the skin thickens and tightens, it gets better over the first 3 to 6 months.
Okay, and what is the recovery like? It's pretty easy?
Recovery's pretty easy. You'll get some bruising. We have you wear some Spanx or a little compression garment for the first 2 weeks or so, but you can go about your business. It's like having a bruise. It's not too bad.
I want to see some before and after pictures so people can get an idea of what it is that the Cellulaze laser can do.
Okay, you can see the really prominent dimple on the left there that is released. Those are those little septations that are drawn in, and then the cobbly appearance on the outside are the bulges that we've smoothed down.
Very good.
Next, you can see there's still a little trace on the right side of these deeper creases, but the idea is to take away the shadowing, because that's what really shows, is when you have those dark shadows of the depth. And this is a real common area, that kind of under the bathing suit part of your little cheek that shows, and the top of the back of the leg. And so if we can tighten that up, ladies feel a lot better in their bathing suits at the beach.
Who was that? I'm just kidding. Some brave.
I'll never tell. Secrets. Doctors
and
never
her name
tell.
was.
Doctors never tell.
I mean,
never give away my secrets.
That is remarkable, though, that the before and after.
It's pretty neat. It works very well. It's very well tolerated, and again, it's minimally invasive. So, you know, we have to make a little tiny puncture to get the laser in, but the laser wand is really tiny. So
how long do the results last?
Well, we have results out for about 4 years, the research, and so you can't really say permanent because we haven't been doing it for 30 years, but we're permanently changing that structure underneath, so really it should permanently change the skin. Right now, we're allowed to say long-lasting.
I think I know what I want for Christmas now. Forget Showtime.
It works. It
Cellulaze.
Works. Right.
All right, Dr. Klein is hosting 2 free seminars to learn more about Cellulaze. They're on November 27th, Tuesday, November 27th. The first one is at noon. The next one is at 6:30 that evening. Call now to reserve your spot because seating is limited. The number is 704-784-4008, 704-784-4008. Renaissance, thank you so much, Dr. Klein. It's great to see you.
Nice to see you again, Colleen.
Of course. All right, when we come back, making your holiday party.